Hi guys, it's Summer J here. Welcome back to my YouTube channel. Today I'm going to talk about the asthma diagnosis I've received with my long COVID and some of the medications I've had to take as a result of my long COVID asthma um, and then I'll break it down another video to talk about um, the autoimmune arthritis I acquired from COVID. And then I think the final video I'll do in this series with long COVID will be on um, menopause, if you will. So, without further ado, let's go ahead and get started. So, I found out I had long COVID, as I mentioned in the first video, from I was getting shortness of breath. Um, Immediately, I was not aware that it was asthma because with the type of asthma I have, it presents with coughing. And so I just, when I'm having an asthma attack, I cough really bad and I can't stop. So I didn't know, I just thought that I got this viral type infection because at the time when I had COVID, the symptoms that are now known as COVID weren't the symptoms for COVID at the time. Back in March of 2022, Aprilish timeframe, I'm not 2022, 2020, excuse me. The symptoms were shortness of breath and um, it was primarily thought to be elderly people, and the perception was people weren't washing their hands, which we all later found out to not be the case. But so I figured out I was diagnosed with asthma in June of 2020, but from April until June, like I kept getting sick again, if you will, not knowing that what my sick again was I was having asthma attacks. I'd have these coughing spells, and I later found out that one of my triggers was stress. And at the time, I had just started a new job, and my supervisor, he became my supervisor maybe around, I started a new job in March, and at the end of March, and I would say around May, I got a new supervisor, and that was his first time being a supervisor. And oh my gosh, um, it was challenging to say the least. But it was challenging to the point that he was stressing me out. And as he was stressing me out, it was triggering an asthma attack. Asthma that again, at that time, I didn't know I had. And so, no, now that I think it was April. The middle of April is when he became the supervisor because I remember towards the end of April I started going I tried to go to the I tried to go see my doctor, but at the time her office was closed and I didn't know that she had COVID. She was battling COVID, but she later told me that she could track what she was going to go through based on what she had previously treated me for. So, from March until like I would say the beginning of April, or no, maybe middle of April, they were trying because again at that time it wasn't known as COVID what the symptoms I had. And so I went through several rounds of antibiotics, several rounds of steroids, and when my doctor was when my doctor, my primary care manager was fighting COVID, was when I had to go to the urgent care. When I had the situation I told you guys about in the first video, um, I went the first time. The first doctor gave me an inhaler because I told her, hey, I'm having problems breathing. And that seemed to work for a while. But when I had at the time though when she gave me the inhaler, I didn't I had not received the diagnosis of asthma. She just gave me the inhaler to combat the shortness of breath. So then when I went back the second time, and the second doctor, who surprisingly was a woman of color, not of African American descent, she was more Middle Eastern. She was the one that was telling me, hey, I think you have anxiety. And so she was being dismissive. At the time then, I was not as educated or haven't experienced as much disparities in care, if you will, at that point. But that was the beginning of some challenges with just trying to get appropriate care. Um, After she pretty much dismissed me, at that time, I think I'd already had an appointment to see a pulmonologist, like my primary care doctor before she got sick had already said, "Hey, I think I'm going to refer you to pulmonology because you need to see someone." But again, since it was COVID, we're talking April-ish, I had an appointment that was in June. I finally made it in to see the pulmonologist, and they did a pulmonary function test, and then they officially diagnosed me with asthma. But getting to the pulmonologist, I was on medications like Symbicort. I started off on the 250 dose of Symbicort and made it up to the 500 dose of Symbicort. I had a rescue inhaler. It was like the little red one. I don't have that particular inhaler anymore. Um, the one I have right now are, and I'm on this one, Breast Tree. So usually I only have to use this Breast Tree inhaler when I have like an episode, if you will. Most of the times, once my asthma's under control, I'm good. I rarely need to use my rescue inhaler, and this is a new inhaler. This was something they just gave me. It has a steroid in it, and then this breast tree has like three different medications in it. But at that time, I was on Symbicort and the rescue inhaler, and I noticed since we were still pretty much in quarantine, I noticed the only things that were triggering my asthma at that time were stress from work and like exercise. I used to work out quite a bit before I contracted COVID in March. And so that was one of the first things that I noticed. Like once I thought I cleared the virus or I was over my cold, if you will, I went to go to try to work out. We had a nice bit of equipment like in our basement. I was in Virginia at the time. We had some equipment in our basement, and I noticed that I would feel better than I would say, oh, I'm going to go and try and work out. And then I would work out, and then, like, within 12 to 24 hours, like, the symptoms would start all over again. Again, with the coughing really bad, not knowing that I was having an asthma attack and that it was presenting with coughing. So, if I'm to the point that I'm wheezing when I'm having an asthma attack, like, I'm in trouble. Like, we need to just go to the hospital because rarely am I, like, in a really bad case of wheezing. So, then I noticed the stress at work. My husband also was like, "Hey, something's going on. Every time you log on for work or you're doing that, you start the coughing." So we had the conversation with my PCM. I think it was on. They were starting telehealth then, and she was like, "Yeah, it sounds like you're having as exercise induced asthma attacks." And stress. So then I had to try to figure out I could control the exercise induced, but I was not aware at the time still that it was my supervisor that was causing me all this undue stress, if you will. So I made it to the pulmonologist in June. They did the pulmonary function tests and they did a CT of my lungs. And at that time, I had air pockets in my lungs um, and then like I think at one time with Alexa, they put this is the 250/50. So this has to be, but this is a recent one. So I'm thinking someone at my current location put me on this one. But like this, I didn't like this one because when you like it clicks, so it has different numbers and it counts your puffs, and you have to like breathe it twice and then make sure you rinse your mouth out. But, and then you take the lever down, you inhale, and it changes once it clicks, it loads it up, if you will, enough for you to inhale. But I don't know. I didn't like the way I felt on this one, but I think this is the generic for the Symbicort. I like the Symbicort much better. But yeah, this I wasn't really feeling this. So I just wanted to show you guys like the different types of inhalers. But these two are this Tree, and I'm not getting a kickback from anybody on anything, but this Tree one, usually I will get a case of pneumonia like once, at least once a year now. And so I try to get the flu and the pneumonia vaccine, and I've had about 7 of the COVID vaccines based on um, the medication I take for my autoimmune arthritis. And we'll talk more about that in the next video. But it compromises my immune system, so I am usually taking, I just try to stay up to date on my vaccines because I've seen what happens when I don't have a vaccine, i.e., when COVID first started, and how rough it is on my body. So if I get it again, it won't be as bad, I'm thinking, but that first round was pretty bad. And but back to the inhaler. So this is Tree, and it has a counter up top. It operates almost like a rescue inhaler. So this one's out. This is my new one. I just started it this morning. And this is the one I have to take 2 puffs in the morning and 2 puffs at night to and make, and like the one that's like the Symbicort or the Alexa, I have to rinse my mouth after I finish it as well, or else you get like thrush or an infection in your mouth. So, but this works pretty good. Lately, here, one in the past year or so, when I've been in a bad situation, this one can usually bring me back. I have to take it for a couple months, but it it does what it's supposed to do. And then once I feel like I can take it or I don't need it anymore, then I can like kind of wean myself off of it and then save it for when I need it again. But this inhaler, this Air Supra, I've been using it since June. I had a really bad upper respiratory infection, mycoplasma mycoplasma infection that it was later, the upper respiratory infection was later diagnosed as a mycoplasma infection, but they started me on this one for the rescue. So, and it did pretty good as well. It's just you have to make sure you're getting the right medication to treat whatever it is you have. I was down pretty much for the month of June because I went to urgent care thinking, okay, they can fix it, or I initially went for them to tell me, hey, I'm coughing, I'm taking my inhaler, it's not working, so I'm thinking I have some type of cold or flu or something going on. Can you help me figure out what it is? They swabbed me for COVID, they swabbed me for the flu, and it was nothing. Well, not neither of those, not nothing. It was something. And so then they gave me a steroid shot, and then gave me a pack of antibiotics and told me I should be getting better within 2 days, and if I'm not, I need to come back. Well, I was good until that was on a Wednesday. That Thursday, I was feeling good until that steroid shot wore off, and then by Friday, I was like back in a worse place, and I was running a low grade fever. So I went back to urgent care, and then they started me on a low dose of steroids, and prednisone. And so then, based on the amount of antibiotics and steroids they gave me during COVID, I really think those base level doses that they give people to fight an infection, I really don't think that, I think my body's immune to them. And the reason I say that is because as soon as I finished the steroids, like whatever that mycoplasma infection came like right back. It wasn't gone. It was just, it seems like it was like just laying low until I finished the medication. And so then I had an appointment that Monday with my primary care, and he's like, "Yeah, this level of steroids they have you on, that's not good enough." Because I went to see him for something else. But I was like, "Hey, while I'm here, let me tell you about what's going on." So then he increased my steroids from the taper dose they had me until he had me on 40, like for like 7 to 10 days. And so anyone who's been on steroids for an extended period of time, you can get snappy and aggressive, if you will. And I can tell you the doses they had me on when we were fighting we didn't know what we were fighting at that back in 2020, but like I had antibiotics that were like uh stuffed with another pill or like so they had me on some serious antibiotics and some serious steroids. I said all of that to say so when I go, and that was in another state, but when I go to the doctor here and they give me the basic pack of antibiotics to fight something, it's just holding it dormant or letting it lie low, if you will. It's not killing what I have based on what my body's used to in terms of antibiotics and fighting off something. So, back to the pulmonologist. I did the pulmonary function test. I had the CT of my chest, and he started me on medications to try to control the inflammation I had in my lungs. So it wasn't until I got super stressed at work with that new supervisor that I ended up taking some time off because it felt like I was getting sicker and sicker, and like no one could tell me what was going on. I'd seen a cardiologist, and it's like, nope, heart's good. I saw the pulmonologist, and then when I took the time off in August, before I took the time off, I had a conversation with my doctor, and she was like, "Well, while you're off, we can run some tests to figure out what is going on because she said COVID's just so new, we just don't know." And by that time, she told me that, "Hey, I think you had COVID because I was able to track everything that I've gone through based on how I treated you couple months or a month and a half prior." And I was like, "Okay, so what do we do now?" And she was like, "Well, I think we need to run these tests to figure out what do you have going on in your body." And so when I say they ran every test under the sun, oh my gosh, they even had some vials of blood that they took that were in bottles that were like maybe a little bit taller than maybe like this tall, and just they they took so many things of blood and they ran everything under the sun to include my hormones. And when those tests came back, um, it talked about how like the results showed that my hormones were like tanked, like estrogen, progesterone, like it, at that point had me categorized and still categorized as postmenopausal. So, but that'll be another video, and I'll talk about like some of the things that I was able to help or used to help me with um, once I found out that that was the state of my hormones. Um, but back to what we were talking about in terms of the asthma. And so one of the things she was looking at was my, uh, well, I'll just briefly introduce that part. So one of the things that came up in the test results was a rheumatoid factor was high. So um, I'll put a pin in that particular discussion so we can pick up on the next video with my rheumatoid factor being high and where we went from there. But ever since then, since I received the initial diagnosis of asthma, now I just try to figure out like what are my triggers. So for me, if I know what my triggers are and I can avoid them, then I don't have to use my inhalers. It's only if I get sick, and usually about at least once a year, I will get sick, and I will get sick to the point that um, I have to pull back out my breast tree inhaler. Um, I'll have to use my rescue inhaler. Like again, when I'm good, I'm good. I don't have to use any inhalers, but like I'm coming off of the mycoplasma infection. It pretty much had me down the month of June, like from the beginning of June when I came back from a trip for work until I would say maybe right before the 4th of July or right after the 4th of July. I started like making my way back to uh, the new normal. I'm not going to say normal because I've yet to see normal, but my new normal, where I can do things and I'm not tired all the time or stuff like that. And if you're having asthma attacks that are presenting as coughing, you can't stop coughing, and you're thinking, oh, it's just a lingering effect from COVID, you might want to go and get that checked out. Maybe get in to see a pulmonologist if you can. Um, I was doing so well, I can tell you. I was doing so well with my medications or not having to use my medication that I think they did a pulmonary function test in December, and I had forgotten and taken the Tree inhaler that morning, which has again other medications in it. So I know there's a steroid in there, and I barely, like, I think you have to have a 20, and I scored like an 18 um, with that medication. And so my pulmonologist was like, well, I think you don't need to, I don't think you have asthma anymore, and hama. And I was just like, remember I took the inhaler. And so then they did another test like the 15th of May. And when I tell you that when they put your body in an asthma induced state, like they give you medication to trigger an asthma attack, if you will, to see if you have asthma. Well, by the time she did the last um, increase of that particular medication, like I could just, I was so tired and so fatigued. I felt like I felt like I do right after I have an asthma attack. I'm really tired. I just want to lay down. And so it was in the middle of the afternoon, and I ended up just taking the rest of the day off because I needed to get myself together. So if you're having episodes or times when you're feeling like after one of your coughing spells, if you're only presenting with coughing and you need to get in to see a doctor so you can get some medical care, and maybe they can do a pulmonary function test on you so that you will have a clear cut diagnosis and you can put an asthma action plan in place. Another thing for me that will trigger me is I remember my son was playing basketball, and we were away at one of his games, and we were checking. He and my husband were getting the car, and I was checking out of the hotel. Well, there wasn't anyone behind the front desk for like a minute. And at that time, I was still heavily wearing my mask. And so I had a mask on, but the lady, and I was like socially distanced from her. This is in April of 2023. But the lady's perfume was so strong that I could smell it through my mask. And by the time someone came to the desk and helped her and then helped me, I had started coughing. And so her perfume had triggered an asthma attack for me. And it got so bad that that episode, either I have my rescue inhaler in my little case, or, but based on that episode, I didn't have a rescue inhaler with me. We were out of town. It just so happened that I we passed a Walgreens before we dropped my son off at his game, and we went back to the Walgreens to see if I could get my prescription filled, and they told me the inhaler had just expired, like the prescription had just expired like 2 weeks ago. And I was like, oh my gosh, no, what am I gonna do? But they just so happened to have um, a Vanderbilt clinic, like if the pharmacy was here, the Vanderbilt clinic was here, like inside the pharmacy right across. So I was able to sign up over there to see if I could get to be seen for an appointment. And someone was supposed to be there. They said, well, we have someone that's supposed to be here at 10. They only get so many minutes of grace. So if they don't show up, you can have their slot. And God worked it out that I was able to get into that slot. They gave me a breathing treatment inside the center, and then they wrote me a new prescription for my inhaler so that I could walk back across to the Walgreens to get the inhaler. And from that moment on, I started keeping inhalers like in different places strategically. Like I would put one at my desk at work and put one in my husband's car, and had one in my purse just so that I wouldn't get caught in another episode of being somewhere, even though I was good and I hadn't had any episodes up until that point. If you didn't grow up with asthma and you haven't always had asthma, you never know what's going to trigger it. And I still to this day don't know what type of perfume that lady had on, but so I know that people's perfumes can trigger an asthma attack for me. So I just keep my inhaler on my person now in my purse. So that was a lesson learned for me. So again, so I want to challenge you, if you're experiencing coughing, make sure you get it checked out. Don't allow someone to say, "Oh, it's just a cold or whatever." No, because you need to know what you're treating. And if you have asthma and your asthma's like mine, it's coughing, you need to figure out and distinguish the difference. Um, Now, one of the things I wish they had done back in June when I first went in for to figure out, am I treating asthma or am I treating this cold or treating a cold, was drawing labs up front and early. Well, I went through 3 rounds of antibiotics, and I think at that time I was on 2 or 3 rounds of steroids before someone, I had to ask, hey, can somebody draw some labs? So you guys keep giving me these um, antibiotics and they're not working. So, and you're changing them. So once I ended up going to the emergency room like on June 22nd, and then they were able to tell me, hey, you have a mycoplasma infection, and the antibiotics you're on right now, they don't fight that. So you need to change and do these antibiotics, and you take the complete round, and that should help clear you up. And it took a couple days for it to get into my system, but once it got in there, then I started to feel a lot better. Like it was so bad that I was trying to start my channel and I was in the bed trying to tell y'all, hey guys, I'm struggling. But I wanted to give you a realistic view of what someone would long COVID has to deal with. So as I may take a snippet if I can pull it into the video just so you can see like the state. Like if you see me now, I'm not 100%. I'm about 75, 80%. But if you could see me when I was in the middle of fighting what I was fighting in terms of that mycoplasma infection, then it takes anything that attacks your body after you've had COVID, and especially if you have long COVID, it takes a little longer for you to recover. Not saying that you can't recover because you can, but I need you to have a little grace with yourself to know that you can do this. If I did it, I guarantee you can do it. Um, and just know that you need to be patient with yourself and extend yourself a little grace. You may not be able to do everything that you were able to do previously, but do what you can and don't overdo it. So that's all I have for you guys today on the topic of post-COVID, long COVID asthma, especially for those of you who did not have asthma or an asthma diagnosis before you had COVID. Just know that you need to fill it out and figure out exactly what your triggers are, because once you know what triggers your asthma, you can either avoid them or make sure you have an action plan in place to mitigate if you were to come in contact with. For me, it's stress, so I try to control my stress. Or perfumes, I never know which ones are, it's going to trigger me, so I try to make sure I have my rescue inhaler with me. Smoke, like someone smoking a cigarette or whatever people smoke in their vape pens or whatever, or even from a barbecue, from a grill, those things will get me going in terms of an asthma attack. So I know to try to stay away from them. Like when we're out and we're maneuvering and people are smoking by the door, guys, don't do that. You have people who, like, we have to take alternate entrances, if you will, because the just to avoid the smoke. So if you're going to smoke, I'm not saying you can't smoke, but kind of be mindful of other people who may be needing to enter and exit a building when you're smoking right by the door. That could jeopardize someone else's health. So until next time, I just want to say take care of you, be true to you, and we'll talk again soon. Have a great day. Go be great.